Good afternoon, everyone. Welcome. Thank you again, friends and colleagues in the media, for being here today at the City County Health Department in Peoria, Illinois. I want to thank you for your continued support of this campaign you have engaged in cooperatively to keep our community informed about the epidemic. I'm happy to report after being gone for a couple of days following Mayor Artis on Monday, it is still all systems go in Central Illinois. The emergency operations plans, their various command centers and incident command structures continue to dig in and make plans for the event. And it's clearly not here yet, but we're preparing for it and we're ready for it. All systems are go. All public safety systems are prepared and ready to respond. The major medical and healthcare systems in our region are all ready to do their part, and we are prepared. And I want you to take confidence in the fact that you live in a community with extraordinary resources, both in the public and private sectors, and some really smart people involved in planning, not to mention our own epidemiologist, the director for the health department, who will be up next, Monica Hendrickson. I'd like to talk to you just for a minute about a couple of simple things, but I think it's really important that since sheltering in place has become the pastime for many of us, it's a new thing. It's not something that we're used to. It's certainly something we never would have expected to happen. But there are some things I think with sheltering in place you have to remember. We're not attempting to put upon anybody this order. What we're doing is trying to stop the spread of disease, and in particularly a pretty aggressive virus. But let's remember to, in our neighborhoods, be sure we check on those of us who are perhaps older or infirm from various medical conditions or disabled in some way. Let's make sure that our neighbors and friends have all of the things that they need. And whether it's through your neighborhood organization or your church or civic organization, let's make sure that everyone who is sheltering in place is taken care of. And if you need help with that, call 211. Let me remind you also, if you are feeling unwell, to call your doctor. If you are feeling unwell and you call your doctor, they have now expanded both with the OSF healthcare system and the Unity Point Health system, comprehensive triage systems, advice lines, and new technologies that whether they're going to talk to you face-to-face or you could use Claire, for example, with OSF system. There are lots of interactive ways by phone or using the internet to get advice on what to do if you're feeling unwell. If you don't have a doctor and don't have a health system necessarily that you're associated with, a lot of people don't, please call 211 or 1-309-999-4029, and 211 will help connect you with Heartland Clinic and we'll find you a doctor. Okay, you don't have to go to the ER, you don't have to call 911 unless you're really, really sick and it's an emergency. 211 and we can get you access to OSF, Methodist, or Heartland Community Health Clinic. Finally, on behalf of the Mayor, Chairman Zimmerman, and Chairman Krug from Woodford County, I'd like to thank everyone who has helped make the last several days of sheltering in place much, much easier for your local governments, and I appreciate everyone lifting their eyes and ears to check on their neighbors. I'll invite Monica Hendrickson up for her report. Thank you.
Thank you, Chairman Rand. Good afternoon. To begin with, the to-date count for the Tri-County region continues to be at 8 confirmed positive cases, 66 negative cases, and 31 pending cases. Again, that is 8 confirmed cases in the Tri-County, 66 negative cases, and 31 pending cases. There are now 32 out of 102 counties in Illinois reporting cases, including Marshall County, just to the north of us. It is important to understand that the stay-at-home or shelter-in-place executive order is an intervention being used to decrease the speed and transmission of the COVID-19 in our communities, especially as we lack vaccines or medications at this time. And with that, there is a lot of information out there around medications or possible other remedies to help you get through this virus. Make sure you're utilizing reliable sources. The Centers for Disease Control and Prevention, or the CDC website, the Illinois Department of Public Health website, and a medical health care provider to get information about how you can control and decrease your symptoms and the issues related to COVID-19. As mentioned, the stay-at-home or executive order of sheltering in place is an intervention, and with any intervention, it can only be as effective as the effort made to comply with it. So thank you to our community partners and our residents for being willing and active members to comply and give a good effort in this. We will not necessarily know the impact of how this will affect the curve, so to speak, for the next days and weeks to come. But that should not be a reason why we should not follow the governor's executive order. This is a community response, and as a community, we need to work together in ensuring the health and safety of all of us. To further discuss safety, especially in regards to domestic violence, I would like to introduce Carol Myrna, the CEO of the Center for Prevention of Abuse.
Good afternoon, everybody. I want to say thank you to those who are leading the operation at the EOC. Your work is important, and I appreciate the invitation. Truth be told, I was feeling a sense of urgency about providing information on the essential services of the Center for Prevention of Abuse, so I really appreciate the opportunity to be here today. Let me also offer a few words of heartfelt gratitude to the caregivers, not just the champion doctors and nurses and first responders, but also the counselors and the caseworkers and the social workers and the therapists who are doing their level best to help everyone and provide safety, hope, and healing. Our mission at the Center for Prevention of Abuse is to help all people live free from violence and abuse. We do so through free and confidential services, emergency shelter, counseling, therapy, casework, medical and legal advocacy, and so much more. The Center for Prevention of Abuse is carefully mitigating COVID-19 and taking precautions to keep our staff, our clients, and those who come in contact with our agency safe and healthy. Many businesses are suspending operations, schools are moving to remote learning, people are advised to distance themselves and to stay home, all in order to keep themselves safe and prevent the transmission of the virus. Yet there remains a population of Americans who are not safe in their homes. It's victims of domestic violence. In circumstances such as the one where we find ourselves right now, victims may in fact be quarantined with their abuser. We know that during times of crisis, including epidemics, the risk of gender-based violence increases, and so does the need for social services and specialized care. The Center for Prevention of Abuse provides essential human services, and it's crucial that we continue to offer our free and confidential care for survivors in Central Illinois who need our help. We truly do not want to see anyone having to choose between their safety and their health. Frankly, abusers can use this time to exploit isolation and social distancing that's currently recommended. Abusers may use these circumstances in order to elevate and enhance their power and gain more control within a relationship. The threats, the confinement, withholding of resources including medicine and finances, the violence or the risk of violence can exponentially increase and create an even more unsafe and dangerous environment. Victims are simply sheltering where they're told, at home as instructed, but it could become the most unsafe place of all. I want to update you on the Center for Prevention of Abuse services and procedures. Our crisis hotline remains staffed 24 hours a day to take calls from individuals who are in danger or in need of safe shelter or crisis intervention. That number is 1-800-559-SAFE. We continue to provide assistance with safe shelter through our Peoria main campus location, while we have temporarily closed our Pekin shelter. Everyone receives virus screenings before entry. We continue to provide assistance with orders of protection that are now initiated over the phone. Individuals in need of filing are encouraged to call our order of protection offices in Peoria, Tazewell, and Woodford counties. Individuals who are in immediate danger should always call 911 or their local law enforcement. We are providing high-quality therapy, counseling, and casework, but now through our telehealth model, continuing to stay connected with our clients and their healing process. While we navigate this unprecedented time, the Center for Prevention of Abuse is devoted to providing services and helping vulnerable populations of survivors of abuse and violence. Please visit centerforpreventionofabuse.org to repeat this information and for all the phone numbers. Thank you.
Thank you, Carol, and thank your team for what they do for our community. Today also marks over a week of school closures for Illinois, and to provide a situational report is the Peoria County Superintendent, Beth Kreider.
Good afternoon. I am so thrilled to tell you that in the 4 days we had no school and were sheltering in place last week, we served over 15,000 meals in Peoria County. And that is something. That's children getting their needs met, even in a situation that is hard for all of us. Some updates about that I'd like to share, however. In Peoria Public Schools in particular, they are moving to a change where you will get multiple meals in one delivery. So instead of picking up a meal every day, they're moving to a Monday, Wednesday, Friday operation, and you get multiple meals in one delivery. We're trying to reduce our exposure, reduce the amount of time that people are needing to come out and pick up those meals. So all of that information can be found on their website. Also, we know that there are some special situations that require a one-on-one delivery. Thanks to an incredible corporation here in Peoria, we have a system of logistics that can get a one-to-one delivery to you and your family if you need it. You can contact masscarepeoriacountyil@gmail.com to get more information about that, and a meal can be delivered to your door. One last thing I'd like to share is the governor announced the school closing is going to be longer than March 30th. We're going to go all the way through April 7th. The Illinois State Board of Education is currently working on guidelines of what those days will mean and what those days will require. Your school superintendents in Peoria County are currently working on a plan and waiting for those guidelines from the state board so that we're ready to keep your children engaged even while they are at home at this time. And with that, I think that's the last update that I have. Just thank you to those schools, those volunteers, the school lunch ladies, the true heroes that are making sure our children are getting their needs met. Thank you.
Thank you, Beth. As this operation continues to go on, one of the key individuals that's involved in this are our EMS providers. And with that, I'd like to introduce Dr. Jackson to discuss our EMS services.
Thank you, Director. My name is Matthew Jackson. I'm the EMS Medical Director for Peoria Area EMS. I also oversee pre-hospital care and EMS for OSF Healthcare. To give you sort of a brief scope of what our EMS system entails, we cover 75 provider agencies, nearly 2,000 providers in the Peoria area alone in a 7-county radius. We provide the medical authority over EMS and including our 911 dispatch. I kind of wanted to go over with you today some of our EMS response to the COVID-19 crisis, one of which being the dispatch measures. We have taken this to the level of letting our dispatchers ask a few simple questions to do some pre-screening prior to arrival of EMS crews. That way we can make sure that we are dispatching the appropriate crews at the right time and to the right patient. Obviously, we want to have a very safe approach for our providers to make sure that they have good situational awareness when they get into a potential case. And that way we know to prepare. It would take very, very little mistake to put down an entire crew into quarantine. So we need to have a measured response to these cases. From that standpoint, when 911 is called and our EMS providers do arrive on scene, they're instructed to do what we call a from-the-door assessment. So when they first make contact, they're maintaining that distancing. We were talking about social distancing. This also applies to our medical providers as well initially. Once they make contact, they're going to be asking a few more questions to determine if there is a risk. Once they figure out that there is a risk, then they will be putting on appropriate protective equipment. When they put on the appropriate protective equipment, they will be limiting providers in the patient's sphere in order to do a proper assessment, and everyone else is being kept outside unless absolutely needed. We are limiting some of our EMS response currently. At some points, you may actually have one provider vehicle arrive on scene, and the ambulance may either be delayed or withheld depending on the circumstance, but you will get a provider at your home or location if you do call 911. But don't be surprised if you have just one provider show up to do the initial triage and screening. I also urge people that most situations associated with this illness are mild to moderate and can be managed from home. Most situations do not require a 911 dispatch. There are a lot of other creative solutions that have been mentioned previously that patients can utilize in order to figure out where they need to go and to get the appropriate help. One of them is the Claire Assistant Chatbot, which can actually be accessed on the OSF Healthcare homepage. The other one would be the COVID-19 Nurse Hotline, which can be reached at 1-833-OSF No, K-N-O-W, or 833-673-5669.
Could you repeat those just a little slowly?
Absolutely. So the COVID-19 Nurse Hotline is 833-673-5669.
Thank you.
Thank you. So I urge people to understand the perception of this and how we are responding to an emergency at this situation. Obviously, we are expecting an increase in call volumes, and we would urge people that if you are not having an emergency, if you are having symptoms, to try one of these other alternative routes first prior to calling 911. And or obviously, if you're having an emergency, we have crews and we have a response plan in place, and we will get crews to deliver timely care to you. We are continually monitoring this situation as an EMS system. We are also in collaboration amongst all the entities in the area, including the two healthcare systems within Peoria. We take a lot of direction from Illinois Department of Public Health in addition to the Centers for Disease Control, and also we are in close contact with the local health department emergency operations center, and we are providing interagency cooperation and sharing of policies and information across all of our system agencies. Thank you.